Hello everyone, Dr. John Bartemus here today with Kim and Pedro, and this is their first visit, and we're interested in seeing them after care to see the changes that are created. So Kim or Pedro, whoever wants to tell us, why did you first seek out functional medicine care?
Well, I can tell you I'm the one who sought functional medicine care. My husband is a medical doctor, and he's been very sick for many years, and we've gone through the traditional path of what traditional medicine had to offer. And not saying that that doesn't work for most people, but it certainly hasn't worked for him. And at a point where we were giving up hope in his recovery, I started doing some research, and I realized the things that his traditional doctors were telling me were not wrong with him, through my research, were exactly what was wrong with him. And I was led to Dr. Bartemus through his videos just from doing research at 2 o'clock in the morning, and made contact, and I've never felt so much hope. So, there's something out there for everybody. Don't stop trying though, because if we were just to take the diagnosis and move forward, we would have no hope.
And Pedro, why don't you share kind of what are you dealing with? Why are you here today? What led you here? How are you limited in your day-to-day life?
Well, I'm limited in ambulation. Sometimes I'm foggy mentally, and I just lack the sense of well-being that I had before all this began back in 1987.
And you were practicing as what kind of doctor?
I'm a pediatrician and concentrate in children between birth and 19. But recently I have been working for a free clinic, and I see adult patients too.
And so what diagnosis have you been given?
Oh my God.
Or what is the suspected diagnosis that brought you here?
The suspected diagnosis is Parkinsonian-like syndrome of unknown etiology, may be associated to the use of narcotics for pain management.
Okay, good. Kim, anything you want to add?
Yeah, what I want to add is this, that my husband and I are both very intelligent people, and we've been proactive during his entire illness. We're conscious of health and supplement and diet and exercise, and yet he was given this medication and he took it in good faith, following his doctor's orders, and things went really well. He never overused. He always minimally used for pain management from several herniated discs. So this happened to us, and we were paying attention, and we were doing the best that we could, and there was no abuse. And all of a sudden, like a sledgehammer, it just came down, and everything about my husband changed. He became nobody. He was silent. He barely responded. And thank God our pharmacist saw me one day, and she said, "Kim, it's the Suboxone. He needs to get off the Suboxone." And we started that journey. It was very lengthy, but I just want to tell you, if it can happen to us, it can happen to anybody. So keep researching, investigating, because there's always another answer. And the people you talk to, they know a lot about this much, but there's this much information out there. So keep looking.
And Pedro, this is your first experience with a functional medicine approach, correct?
Yes, absolutely.
And how, coming from a conventional medical training and background, what would you say about it?
Well, I'm blown away. I just cannot believe that this has been around, and I didn't know about it. I, for the first time, have a true, sincere sense of hope that I'm going to get better. And time will tell in the next 3 months.
Excellent. And what's the goal for the next 3 months?
I want to be better enough so that I can return to practice in the free clinic.
Awesome.
In my town.
All right. Well, that's our goal, and hopefully we'll, at the 3-month video, you can do a little jig for us.
I will.
All right. Thank you for sharing.